Time is running out. The deadline to enroll in a health care plan through the ACA is only 2 months away from today. August 15th is the deadline. So what are you waiting for? We have experts to help you navigate that process. Catherine Sevier is with AARP of North Carolina. Morgan Campbell is with Alliance Insurance Services, and Laura Packard is with Get America Covered. They're all here to answer your questions, health care related, whether that be Medicare or ACA or just your regular health plan. You can text us a question, 336-379-5775. Remember, this is text only, so please don't call. Again, text only. All right, Laura, let's start first and foremost with some news that folks might be hearing later on in this week when it comes to the ACA healthcare plan and the Supreme Court.
Okay, there has been a court case that's been working its way through the court system for a couple years now, and it's finally gotten to the Supreme Court, and the Supreme Court will be releasing their ruling any day now, but by the end of the month for sure. And they will be deciding whether the Affordable Care Act stays in place, whether part of it is dismantled or all of it. But don't panic. Don't panic yet. Pay attention, but don't panic. And also, whatever happens, contact your legislatures in Congress, your senators and your representative, and make sure that they know that healthcare, affordable healthcare, is important to you.
All right, so if there are folks at home, and we just heard Laura say, don't panic, but as you are on the other side of that, you are on the insurance company side of that, what are you seeing that maybe lends you to believe like, hey, really don't stop your health insurance like right now?
No need to stop the health insurance right now. We need to wait to see what the Supreme Court is going to rule. And every insurance carrier that participates on the ACA, they have a backup plan. They're prepared for whatever could come down.
Right, and I know people at home are probably like, well, does that mean that I should sign up, that I shouldn't sign up, that I should wait to sign up? Laura, your thoughts on that?
Well, if you need health insurance and if you have a body, you need health insurance, then you should get covered today, especially if you're eligible for a cheap or free insurance plan, because then what are you losing?
All right. Well, let's take a look because we want to make sure everybody knows what the new dates are when it comes to enrolling in health care. Because again, we know that, lawsuits and things, they drag on for a while. So we don't want you missing any kind of enrollment date. So the new dates for the ACA enrollment, the deadline is now August the 15th. And that's been put off a couple of times, but at this moment, it is August the 15th. And what happens if by August the 15th you haven't signed up, or if you haven't changed your healthcare or made any different elections? What happens then?
So what happens after August 15th, you're basically in a small lockout period, because then we go into open enrollment, which starts November 15th and runs through December 15th. So there's still another opportunity right around the corner.
Right, but you would have those a couple of months, either A, without any kind of coverage, or maybe coverage that you're paying too much for. For folks at home who are like, you know what, I know I can go online and I can probably look at the 1,000,001 plans that are out there, but I really don't know what's best for me. Morgan, kind of explain how it works when people are getting their insurance and how an insurance provider can help.
So what we can do is we can look at the plans for you. We can look at your medications, figure out which formulary they're going to fall in. We can make sure that your primary care physician and any specialists that you see are in the network. You would not want to get into a health insurance plan that you had to give up your primary care physician that you've had for 30 years. You're not going to be happy, and you're not going to have a pleasant experience with that.
All right, so you might want to try an insurance company. It's not that you pay them. You don't pay them to help put you in an ACA plan. So that is something that is really important to know. If they're asking you to pay them, you need to walk right out that door, because they are not supposed to be paid by you. They are paid by the insurance company. All right, Catherine, let's go to you, because you are able to also answer questions about Medicare. And the question that we get every single time is, when do I have to sign up for Medicare?
So you have to sign up for Medicare as you approach your 65th birthday. So 3 months before to 3 months after, or the month that you actually have your birthday. So you want to go in and sign up. Most people automatically get Part A for free, and then you'll be asked to sign up for Part B. If you don't sign up for Part B when it's offered at that point, you need to have only one good reason for not doing it, and that's because you have employer insurance that is legitimate for coverage for your Part B. Otherwise, sign up, because if you don't, you'll pay a penalty when you try to get it later.
Okay. All right. So we are getting some questions here. Oh, you know what? We got 30 seconds. So I'm going to table that question because there's no way they're going to answer this in 30 seconds. We're taking your text questions. Make sure you text us at 336-379-5775, and we'll be right back.